Good afternoon, Long Beach. This is our briefing for July the 2nd, right before the 4th of July holiday. We have a lot to go over today, and want to just begin by making a note that all of our numbers that come in today are important. We've been hearing a lot in the news about what the governor is saying with closures and cases going out, so we want to get through all of that. There's just going to be just a lot of information. Alice from the Health Department will be doing a recap in Spanish at the end. And also, of course, Paola, who's doing our ASL translation, is doing our translation as well. Dr. Davis is also here, who will give an update and answer any questions from the media. We have 4,379 residents have tested positive for COVID. Total, about 3,000 have recovered. We've lost 134 residents to COVID-19, making COVID the leading cause of death, of anything that is a major cause of death that we track in our city as it relates to, you can think about homicides or car accidents and other things that take people's lives. We also have had 580 cases since this Monday, so there's been an increase. And I want to start by talking about what's happening with COVID in Long Beach. First is our positivity rate is increasing. So our recent data shows a sharp increase in COVID-19. This past week, we've averaged over 130 cases a day. That is a 26% increase in total cases. Just comparatively, in May, we were averaging 40 cases, if you look at mid-May. So that is a sharp increase. That's not unique, of course, to Long Beach. You're seeing these increases statewide and in some cases across the country in many states. It is very concerning. Our 7-day average of the positivity rate has increased from 8.5% to 10.8% of who we're testing, how they come back as positive. And a lot of folks say, well, you're doing more testing. That's true, but we're not, it's not just a more testing issue. It's the fact that more people that are getting tested are testing positive for COVID-19. We are seeing more young adults and children testing positive. And this is something that's really important for families. More and more kids and young people are testing positive for COVID-19. And this is, of course, because there's just more community spread out in the community. Thankfully, our hospitalizations and fatalities are still stable and remaining low. And I want to share with you some of what we are hearing. First is I spent the day yesterday talking to a lot of our hospital and medical leaders. I talked to the head of St. Mary Hospital. I talked to the head of Memorial and Miller's Children, just to see how they're feeling and how things are going. What they told me is, first, they're thankful to all of you that are doing the right thing, wearing a mask, being safe, washing your hands, staying at home when you can. But they're also very concerned that as they are starting in just the last few days to get more folks coming into their hospital that are testing positive. Now, of course, not everyone is hospitalized. You're trying to get people in and out of the hospital. But their level of concern has increased in the last couple of days. That's directly from them. Now, if you look at the data, our hospitalization number has not yet spiked. And in fact, our capacity at our hospitals is still at about 60%. So there isn't the strain yet on room, but they are beginning to see more folks come in. And that is concerning because we can expect possibly there to be a lag in cases and what that hospitalization rate could look like 2 or 3 weeks out. We have parts of the state that are meeting over 90%. Riverside is in some cases at 99% capacity in their hospitals. We're at 60. We don't want to get to 75, 80%. Which is why we're being as careful as we can. Our ventilators, we still have about 30% of them are in use. We have a lot of ventilators still available, and we've worked really hard to make sure our hospitals have those in place. So my cautionary note is the positivity rate is up. That means there are more people in Long Beach with COVID-19 today, right now, than there were in the past, at least per our testing, which means we need to be very careful about who we're interacting with, being physically distanced, face covering, washing hands, and being careful. I want to talk to you about testing. First of all, Long Beach is seeing what is happening across the state and county, which is a huge rush of people wanting to get more tests. This happened very quickly in the last couple of weeks especially. A lot of people with no symptoms are now wanting to get tested. And we understand that. We encourage people to get testing. We have been doing about 1,000 tests a day. And by the way, the state suggested number for us to be testing 750 a day. So we exceed kind of the state's ask of us, and we should be. And so we're doing robust testing. But in order to get more tests in, I want to share a couple of things. One is all of next week, we've bumped it up from 1,000 to 1,400 tests a day at all of our sites. We want to make sure that we can see people that need the tests. That's number one. The second thing is I want to clarify very clearly that if you need to get a test, even if the appointments are full, you can get a test. So think about the appointment system as essentially an appointment, a drive-through appointment. You might notice that across Long Beach, we currently have 5 major operational sites. Of those 5, 3 of those sites are full for appointments for the next probably a little over a week and a half, 2 weeks. 2 of those sites, which is the Jordan's Plus site and the PCC site, those sites, every single day, appointments open up. And so while you might not be able to get an appointment on the other sites, if you check every day, those sites will open up appointments for like the next 2 days, 3 days out. And so there are still appointments available at those sites. But more importantly, if you are symptomatic and you need to get a test, you want to test, for example, on the day you're feeling sick, you can get a test by walking up to any of the sites with the exception of the Jordan Plus site. That site's a little different, doesn't do walk-up testing. But all the other sites, you may not be able to get an appointment, but you can walk up to the site. Essentially, you park your car adjacent to the site and you walk up to get a test. I will tell you that we're encouraging, however, while you can get a test and a walk up anywhere, the best place to get a same-day testing is at the PCC campus at Long Beach City College, at our rapid response clinic and testing site we have there. So I just want to be very clear. If you are a Long Beach resident and you can get a test the day you are feeling symptoms, you just need to go to the Long Beach City College and go to the walk-up rapid response clinic or testing center, and they will help you that day, particularly if you're symptomatic and you want to test. The other sites, you can, with the exception of Jordan, you can also do a walk-up test. There's just a little less capacity there. You might wait a lot longer. And so, again, I know there's been some reports about there being a wait for testing, and that is true. There is a wait for appointment testing, but the walk-up testing is open every single day, and Jordan Plus and PCC appointments open up about every single day as well for those appointments. So hopefully that brings some clarity to that. We want you to get tested. You can get tested in Long Beach every single day. Now I want to turn to our closures. As you know, the governor just mandated closures for what the state's calling higher risk businesses. As COVID, we learn more about COVID every week. And so different closures now, we're learning what is higher risk than what we may have known before. We know that in Long Beach, LA County, Orange County, all across the state, the governor has closed restaurants indoors, the dining rooms. You can still eat at restaurants outdoors. You can still get pickup and to go, but he's closed the dining rooms. He's also closed our museums, galleries. The aquarium inside is now closed, and other similar facilities. This is all about public health, and we want to continue and maintain public health. Also want to note that bars remain closed. Those were already closed, unless bars have a kitchen and a restaurant permit to operate like a restaurant where you could serve food, if you have a patio. But the inside of bars have to be closed. Again, this is happening statewide in most of the counties that are not rural counties. We've expanded our Open Streets initiative. So we've installed, I think, about 20 parklets across the city. I believe another 20 are being installed over the next few days. and we encourage restaurants to get involved in this program. We want to do more and more of these parklet programs, especially now that the dining rooms are closed. Now I want to turn to the 4th of July, which is, of course, this weekend. As a reminder, major fireworks shows have been canceled here because of gathering issues. We've not permitted block parties for similar reasons. Personal fireworks, even the ones that say safe, all fireworks are illegal in Long Beach. And so please, this has been such a problem this year. And for those that are, me included, I hear the fireworks every night, are frustrated. This is, the country is frustrated. There has been an explosion of illegal and even legal fireworks all across the country. In Long Beach, up north, in LA, in New York, you name it, there has just been an influx of fireworks into the United States that is causing a massive problem. So we're trying to get a handle on it. It is not easy to catch folks in the act, but you know the city prosecutor has put in a new system to try to report those. So please just continue. 4th of July is here. Fireworks affect our veterans and our animals, and it's just a shame that people can't respect each other, especially in a time like this. Now I want to, finally, before I turn this over, I want to transition to announcing two new programs we're going to be announcing today. Just on our last briefing, I announced two new initiatives and funds. One was we're proposing a new Black Health Equity Fund at $1 million to assist us, knowing that our Black neighbors in our community are dying twice the rate of population because of COVID-19, infant mortality, and a lot of other health indicators. So we want to put more money there. We also announced a fund for nonprofits in the city at $1 million that are going to be doing health work around COVID-19 to go out in the community and provide sanitation kits, economic relief, whatever it is to the community, particularly for organizations that they're doing work in communities that are disadvantaged communities and that really need the support. So that $1 million is also in place that will be launched for the city. Today I'm going to announce two new funds that we're proposing to the City Council and to the city. The first fund is we're going to be proposing and launching a new Youth Ambassador Fund. This Youth Ambassador Fund, we're setting at $1 million, is going to assist to hire young people in our community to go out into our neighborhoods and support each other around issues around health. These youth ambassadors will train and educate the community, will train and help each other, will provide sanitation opportunities, kits to low-income families, and work especially in dense neighborhoods and communities that really need the additional support where we're seeing the greater spikes of COVID-19. $1 million in this fund will be able to hire a lot of young people in this city for the next few months to not only help us with COVID-19 response, but to provide these young people a summer job where they can work, they can be proud of the work they're doing, they can learn about health and how we take care of each other in our city, have that responsibility, and also have something to do over the summer with school being out and so many other functions. We're going to work with already established nonprofits in the city so that they can hire these youth ambassadors. And we're going to start that fund at $1 million. And I'm very grateful to the staff for working on this, and it'll be presented to the City Council. And the second fund I want to introduce today, we're also going to set at $1 million, is we're going to be providing direct aid to our business improvement districts. Our business improvement districts, when you think about the Bixby Knolls Improvement Association, or the Uptown bid, or the Downtown Long Beach Association, or the Cambodia Town Midtown bid, these are organizations that are working directly with small businesses, and we know they all have a need to do health work, support these businesses with grants, with loans, with storefront improvements, to help them get past this COVID crisis, unemployment, issues around jobs and security for these workers. And so the bids will get direct support to do this work And they have already a council of business associations in place that will allow them all to get direct support for our businesses. And they will work directly with the businesses. There will be additional resources and funds for businesses that are not part of BID, so that is coming down the pipeline. We'll have announcements on that next week, but I wanted to introduce those two funds. Now, all four of those funds, each set at $1 million, are coming from the governor's support that he has provided over $41 million to the city of Long Beach for COVID response. Those dollars would not have been possible without strong advocacy from your city. In fact, the city of Long Beach led the effort to get those funds where 6 cities got direct allocation from the governor. And we're proud of leading that coalition of cities and proud that we got a significant amount of money out of that. And we'll have more on how the rest of those funds and how we're proposing spending those as it relates to COVID and health over the course of next week. And so I want to thank everyone. I want you to have a safe 4th of July weekend. And as we close, and I turn this over to Dr. Davis, I just want to also note that we are going to be transitioning these COVID briefings. We have in the past, we did them Monday, Wednesday, Fridays. Then we switched them to Mondays and Thursdays. Starting next week, we're going to be doing them as needed. So we'll still be having briefings, but we want to have more flexibility to have them pop up on certain days, depending on what the need is as it relates to COVID-19. And I think you've seen other cities and regional agencies do the same thing. And so we may not have one on Monday, it might be Tuesday, it might be Wednesday, just depending on what the need is, but we'll announce those in the morning to the media so they can continue to ask questions and we'll continue to be accessible to the public. And with that, I'm going to turn this over to Dr. Davis, and I want everyone to have a safe 4th of July weekend. Thank you.
Thank you, Mayor. Good afternoon. Over the past week, we've talked to you about our stability criteria and the possibility of reversing some of the steps we've taken to reopen if our data didn't improve. And unfortunately, that's where we are right now. If we're going to slow the spread of COVID-19, we must all do our part. The best way to protect yourself and others is to limit your interactions with other people as much as possible, especially those outside of your household, and take steps to minimize viral spread when these interactions cannot be avoided. That means wearing face coverings and practicing physical distancing and making sure you wash your hands frequently. Keeping our distance helps keep others safe and is an essential way to slow down the spread of COVID-19. Across the country, we've seen a number of COVID-19 outbreaks that began at large and not so large gatherings. These gatherings include indoor and outdoor, planned and spontaneous events. I want to reiterate, as we're heading into a national holiday, that events and gatherings are still prohibited in the city of Long Beach. Gathering with people outside of your household right now is still prohibited. Again, the more people you interact with, whether that's on a regular basis or at a one-off event, and the longer that interaction lasts, the higher the potential risk of viral transmission. We are seeing new cases, and increasing locally, regionally, and nationally. And we're also seeing increasing hospitalization rates in other states and regions. I hope you'll reconsider gatherings with people that you don't live with, not just for this weekend, but for the time being going forward. I know this all feels like an inconvenience, and we wish that things were normal, but it's the best way right now to protect our families, friends, and neighbors who may be vulnerable. So for the 4th of July, please celebrate with your household at your home. So now I'd just like to turn to face coverings. So I'd like to talk briefly about the importance of the continued use of face coverings. There's been a lot of recent data that really supports using face coverings as a way to significantly decrease the risk of transmission of COVID-19. There was an article recently published in a medical journal called Lancet, which reviewed 172 studies from 16 countries and found that face covering use can largely reduce the risk of COVID-19 transmission. This inexpensive practice, when practiced alongside physical distancing, quarantining and isolation, contact tracing, and other measures, represents our best opportunity to fight this pandemic. And just a quick reminder about washing your face coverings. So when you're machine washing your face coverings, it's okay to wash with your regular laundry with normal detergent. Wash on the warmest appropriate setting for the cloth used to make the face covering. If you're washing by hand, wash in a bleach solution with 5 tablespoons of bleach per gallon of room temperature water. And when you're drying your face covering, dry completely in a dryer using the highest heat setting or lay flat to air dry in direct sunlight if possible. So in closing, prevention efforts only work if we all participate. We all play a part in this pandemic right now. So you, me, others, employers, businesses, elected officials, enforcement agencies, all of us. And slowing down or preventing the spread of this virus will take all of us, and it will save lives. So please continue to take this seriously and make decisions that protect the health and safety of yourself, your loved ones, and your community. Thank you.
All right, thank you. Now we will take a few questions from the media. First question comes from Haley at the Press Telegram. Go ahead.
Hi,
Haley.
can you hear me?
Yes, we can hear you.
Okay, great. My question is for Mayor Garcia. I know you touched on the parklet aspect of the Open Streets Initiative, but I remember when the City Council discussed it, there was also the idea of closing down bigger arterial streets like Retro Row, I know is one that was mentioned. So can you just provide an update on what that part of the program looks like right now?
Yeah, so the city's still working on some of those larger closures. There's some areas that prefer them, some businesses that are less interested, and so that's still moving forward. I think you're going to see a significant amount of parklets and street openings this upcoming week, and so that's from what I understand from the staff, and so that's still moving forward. I'm not sure where the Retro Row one specifically is, but we still want all the other ones to go forward.
Okay, next question comes from Ashley at the Long Beach Public Radio. Go ahead, Ashley.
Thank you. Mayor Garcia, with the city's eviction moratorium set to expire at the end of this month, what actions are you and City Council currently looking to take to proactively protect individuals and businesses who are once again facing these closures and loss of income? Could we see a potential rent forgiveness program implemented here locally?
What I think the council is probably going to have to take up again. I think next Tuesday we're taking up some kind of rental tenant issues, but the big ones that are going to come down the pipeline. I think the council's going to have to debate about the current eviction moratorium that's in place. Some other agency that extended that another 30 days. I think with what's happening right now with COVID and people out of work again, I think that the council needs to bring up again a discussion around that extension. So I expect that will come forward. We also announced today the rental assistance program today or yesterday, and so that provides $1,000 for 3 months for tenants that qualify, and then if we have more folks apply that qualify, there will be like a lottery system to select those folks. We're trying to add more money into that pot also to expand the amount of people that get that assistance. There is obviously eviction moratorium work happening on the commercial side as well, and I think we have to be honest with each other that in this new economy and the way COVID has hit us, we have to rethink the way I think the government supports tenants and property owners and businesses, and I think it's really those of us that have been involved. For example, when you talk about in the past, issues that used to be controversial to some, not to me. I've always been interested in programs like universal basic income. For example, I think that's a good example of a program that should be revisited nationally, and I'm very supportive of launching a pilot program in Long Beach to look at, the economy's changed so much and it's forever changed. We have to rethink the way people get assistance, and Congress should pass more direct assistance to people. And if Congress isn't going to do it, cities are going to have to do more and step up and provide some of those resources. So I support that. We have limited resources, but we're going to find and figure out new ways moving ahead, and certainly in the budget that I present in a couple months on how we get more direct assistance to people that need it in the age of COVID. There's just relying on jobs that may or may not be there, or jobs that may not come back after COVID, is just not going to be enough.
Thank you, Mayor. Next question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hi there. So the governor mentioned today that the statewide ICU occupancy rate was 49%. You talked a little bit about that Long Beach was at 60% capacity, but are you hearing from the leaders at St. Mary's and at Memorial about concerns about getting to capacity in the weeks ahead? And then also, is there a renewed push or status update on getting community hospital open after the big rush in mid-March?
Good questions. The first answer to the first question is yes. So I'm both Carolyn Caldwell at St. Mary and John Bishop at Memorial. I talked to both of them yesterday. Were more concerned that they've been in the past around capacity. Now, overall hospital capacity is still at 60% citywide, but they specifically said that in the last 2 days, they have seen more people start coming into the hospital that are both symptomatic, that are testing positive for COVID. They're trying to clear beds, of course, and get folks out of the hospitals to create room. Their concern is, even though we're at 60 today, you can get to 80 real quick. And so that is their concern. And so, yes, they are concerned, and they can be asked that directly. But right now, we're managing all right. The second part is community hospital. We have been wanting community to open for weeks. It feels like probably it's been months that we want to get hospital open. Having also talked to the partners there at MWN just recently, they are, I know we've said in the past they're close. I do think they're actually close. They're waiting on a state licensing agreement that the state comes in and gives them their final approval to open. They have staff in place. They are paying their staff. They're ready to operate the hospital. And now they're waiting for the California Department of Public Health to come in and do the final check so they can reopen. We need community hospital open. We need that facility in place. And especially if the COVID crisis continues, those are beds that we need. We can get 100 beds open at that hospital like that as soon as it opens up. So I'm optimistic that it's on its way. But again, the decision is not in our hands. It's in the state's hand. And the state has been slammed on its health side on COVID.
Thank you, Mayor. Now we have a few questions for social media. The first one goes to you. Beaches are closed, but parks are not this weekend. Can you talk about enforcement in both situations?
So, listen, I think people need to understand enforcement's hard at parks and beaches. We have fireworks going off. We have a social unrest that requires the city's attention to ensure that we are listening to the voices and the protests and what's happening on the streets. We have violence that has recently crept up in parts of central Long Beach and northern parts of our city. And so the city is stretched thin. At the same time, enforcement around COVID is important. When it comes to parks or beaches, one of the reasons why beaches are closed, not just in LA County and Long Beach, but Orange County and other places, is for this exact reason. Beaches on the 4th of July are the most popular places to go, and we would have seen them packed full of people, all gathered around each other, and in many cases, giving each other COVID. And so parks, people still need to go out and have passive uses and walk their dogs or walk their families. As it relates to parks, we know that families can congregate together, but others should not be. And I, like every single one of you, when I'm driving my car around and I drive down and pass the bluff, or I'm driving down Bixby Park, or I pass whatever park I'm driving by and I see what's happening, I get frustrated also. People need to self-police themselves. People need to show care for each other. And so I would hope that people are responsible at our parks. We don't want to close our parks. That's not where we want to head. We want to keep our parks open, keep them for open space and active use, but just be respectful and responsible. And we're going to be out enforcing a lot this weekend. But there's also only so much you can do with the resources you have when you're not trying to just enforce parks, but also making people start off the beach and making folks that are lighting fireworks, and making sure that our health department is fully staffed, and that we're monitoring our testing sites, and that we're making sure that that businesses aren't open that are not supposed to be, or that we're making sure that a restaurant is operating safely under the health codes. All of that takes an enormous amount of people, and your city is doing, I think, an amazing job with the resources we have and the great team that we have in place. So we will try our best.
Thank you, Mayor. The next two questions are for Dr. Davis. Doctor, several questions about nasal versus oral swab testing have come up. Can you explain the difference?
Sure. So there's basically 3 different testing specimen collection sites. There is the nasopharyngeal, which is abbreviated NP swab. There's the oral pharyngeal, which is a throat swab, and that's OP swab. And then there's the nares, which means more of kind of either the front of the nose or kind of in the middle of the nose. And the NP swab is traditionally what was used the most. It's very invasive. You have to go way up there, so people find it very uncomfortable. The oral pharyngeal or the throat swab is less invasive, easier to do, but isn't as accurate as that NP swab is. And then later on, either the mid-nares or the anterior nares swabs were introduced, or specimen collection sites were introduced, and they're about equivalent to the NP swab, the one that's much more uncomfortable. So in general, and the other good thing about the nares swab is that you can collect it yourself, which means that the person who's interacting with you, the healthcare provider who's interacting with you, doesn't need to have the full PPE with the mask and the gown and the gloves and all that. So the nares swab is a good option because it's about equivalent to the one that's really invasive, so you get good results, and you can collect it yourself, and then the person doesn't have to wear the PPE, so you can save that scarce resource when you really need it.
Thank you, Dr. Davis. One more question for you. As we've seen the state close down some businesses lately, is there any consideration for reclosing gyms?
So everything, of course, is on the table, and it will all be kind of decided by what happens going forward. So what happens with our cases, with the hospitalizations, with our capacity. So of course, all of that, all of the things that are open are on the table. What we really hope is that we don't have to go to those things. So if we could make some sacrifices now, by not having gatherings, by wearing our face coverings, by washing our hands, by being careful when we're at work, really limiting the amount of time that we're out of the house and where we're going, that will really make a difference and hopefully mitigate the necessity to have to close further things.
All right, thank you. That's the end of questions. Now we will have Spanish translation.
Muy buenas tardes, gracias por acompañarnos esta tarde. Esta es nuestra sesión informativa del 2 de julio. Desde hoy tenemos a 4,379 personas que han salido positivo del coronavirus. Esto incluye un aumento de 580 casos desde el lunes. Además, Lamentablemente hemos perdido a 134 residentes y 101 de esas muertes se han sido asociados con centros de enfermería de largo plazo. Vamos a empezar con unos datos sobre el incremento de la tasa de positividad. Los datos recientes muestran que hubo un fuerte aumento en los casos del coronavirus durante la semana pasada, con un promedio de más de 130 casos por día, un aumento de casi el 26% en todos los casos. El promedio de 7 días de la tasa de positividad diaria también aumentó desde el 8.5 hasta el 10.8 hoy en día. También hemos visto un aumento en los casos de niños y adultos jóvenes, que es muy preocupante para nuestra comunidad y nuestras familias. Los aumentos de coronavirus pueden atribuirse a la propagación de la comunidad. Eso significa que como hay más negocios abiertos, por lo tanto hay más personas afuera, hay más personas en la comunidad. Afortunadamente, nuestras hospitalizaciones y muertes siguen siendo relativamente bajas. Continuaremos monitoreando los datos y siguiendo las recomendaciones de nuestros socios de salud pública al nivel local, al nivel estatal y federal para reducir la propagación del virus. Este aumento requiere medidas para limitar el nivel de contacto de persona a persona para evitar hospitales y que se empiecen a ocupar los hospitales dentro de la ciudad y reducir la velocidad de transmisión. También recuerden que este día sí tuvimos unos cambios con nuestros sitios de prueba. Los únicos 2 sitios que estarán abiertos serán mañana Jordan High School y Cabrillo High School. Recordarles también que sabemos que a veces se llenan las citas, pero es muy importante dejarles saber que pueden chequear día a día porque de vez en cuando se abren, la gente cancela o en nuestro sistema agregamos más citas o puede chequear día a día para poder agarrar una al mismo día. También queremos decirle que nuestra meta es como de probar a 1,000 personas al día y para la próxima semana nuestro número va a ser, nuestra capacidad de pruebas va a ser 1,400. También queremos dejarles saber que en la ciudad tenemos la clínica de evaluación rápida que está en el colegio de Long Beach City College, el que está sobre la PCH. Ahí pues, hay disponible las pruebas que puede hacer a pie, eso no necesariamente tiene que estar en su automóvil. Si un día se despierta o empieza a sentir síntomas de repentemente, puede hacer esa cita, la puede recibir el mismo día, nomás usando el sitio de prueba de Long Beach City College. También queremos platicar un poco sobre las celebraciones de este fin de semana de feriado. Sabemos que estamos acostumbrados a celebrar un poco diferente, pero queremos decirles que los eventos, espectáculos de fuegos artificiales o los eventos de cohetes no están permitidos. No va a haber este año el Big Bang on the Bay y el espectáculo de fuegos artificiales sobre el Queen Mary tampoco no va a pasar. No se permiten fiestas por razones similares. No hay que congregarnos con gente que no vive en nuestro hogar, que no sea nuestra familia inmediata, que vivamos juntos. Recuerde que aunque sean legales o ilegales, los cohetes no son prohibidos en la ciudad de Long Beach. Es el ruido. Nosotros hemos estado recibiendo llamadas que mucha gente está encendiendo estos cohetes ilegales, no solo en nuestra ciudad, pero por todo el país. El ruido crea mucho pánico en muchos animales y también en los veteranos. Recuerden respetar las reglas y las pólizas. Un poquito más de información sobre las reuniones, porque durante la semana pasada hablamos con ustedes acerca de los criterios y la estabilidad y la posibilidad de reabrir algunos de los pasos que hemos tomado para reabrir nuestros datos y comenzar a mejorar la situación. Pero desafortunadamente ahora estamos viendo la situación y la propagación del virus, pero todos debemos hacer nuestra parte. La mejor manera de protegernos a nosotros mismos y a nuestras familias son limitar las interacciones con otras personas, tanto sea posible, y tomar medidas para minimizar la propagación viral cuando no se pueden evitar las interacciones. Eso significa practicar el distanciamiento físico y usar nuestras coberturas para la cara. Mantener nuestra distancia ayuda a mantener seguro a los demás y una forma esencial de frenar la propagación del virus. En todo el país hemos visto una serie de brotes del coronavirus que comenzaron en grandes reuniones. Estas reuniones incluyen eventos interiores y exteriores planeados o espontáneos también. Queremos reiterar que nos dirigimos hacia un feriado nacional. Los eventos y las reuniones aún están prohibidas en la ciudad de Long Beach. Estamos viendo nuevos casos y tasas de hospitalización que aumentan local, regional y nacionalmente. No tengan reuniones con personas con las que no viven, y no nomás este fin de semana, pero hasta el futuro, hasta que podamos relajar un poco la orden del seguro en el hogar. Aunque se siente que esto es muy inconveniente y deseamos que las cosas sean normales, pero la mejor en este momento para proteger a nuestras familias y amigos y vecinos que puedan ser vulnerables. Por favor, comiencen a... Claro, queremos que celebren y disfruten su fin de semana feriado, pero más seguro que lamentar. Ahora es un poquito más de información. Vimos un artículo publicado por una agencia que tuvo 172 estudios en 16 diferentes países que descubrieron que el uso de las máscaras, de las coberturas faciales, puede reducir en gran medida el riesgo de infección del coronavirus. Uno de los estudios principales concluyó que la transmisión del coronavirus era principalmente transmitida por el aire. Por lo tanto, usar las coberturas para su cara en público puede ser la forma más efectiva para prevenir la transmisión del virus. Solo un recordatorio, porque usando las coberturas de la cara y implementando el distanciamiento físico es lo más práctico, lo más barato y lo que va a salvar más vidas. Un recordatorio sobre cómo lavar y cómo cuidar sus coberturas faciales. Si son de tela, es lavarlos en la máquina. Está bien si las lava con otra ropa, pero tratar la manera de usar el agua más cálida y apropiada para el paño y para las coberturas que están hechas de tela. Si las va a lavar manualmente, lávela con una solución por cada galón de agua, ponerle como 5 cucharadas de cloro. Y cuando la seque, es importante que lo seque en la temperatura más alta, más caliente, o que le dé directamente el sol. Para cerrar, nomás queremos recordarles y los esfuerzos de prevención solo funcionan si todos hacemos y ponemos de nuestra parte. Y ralentizar o prevenir la propagación sí salvará las vidas si es que todos nos ponemos de nuestra parte. Por favor, continúe tomando esto en serio, tomando las decisiones que protejan la salud y la seguridad de usted y de sus familias. La esperanza que los miembros de la comunidad de usted vean y posean esta información y aumenten los esfuerzos que está tomando para dirigir las tendencias en una dirección más positiva. Con eso creo que ya es el final, es toda la información que tenemos por ustedes. Tengan un buen fin de semana y celebren sanamente. Sabemos que son fiestas festivas y el aire, el sol, hay muy buen clima, pero por favor cuídense y sigan al tanto. That's everything for today. Thank you so much for joining us. Please have a great and safe holiday weekend. Thank you.